Today we're diving into a topic that's sure to hit home for many of you, the infamous 9-month sleep regression. If your once perfect sleeper has suddenly turned into a night owl, you're definitely not alone. This common sleep hiccup can leave both babies and parents feeling exhausted and frustrated, but fear not, we've got some tips and tricks to help you weather the storm. The 9-month sleep regression is a period, typically lasting a few weeks, when your baby's sleep patterns take a nosedive. They might start having trouble falling asleep, wake up more frequently throughout the night, or fight naps like it's their mission in life. It's like they've suddenly realized how exciting the world is and don't want to miss a single moment. So, what does this sleep regression actually look like? Well, your little one might start taking longer to drift off to dreamland, even if you've stuck to your usual bedtime routine. They might also wake up more often during the night, sometimes as frequently as every 2 hours, leaving you both groggy and grumpy come morning. Naps can also become a battleground, with your baby resisting them altogether or only snoozing for short stretches. All of this can add up to one cranky, overtired baby. But why is this happening, you might ask? Well, there are a few key culprits behind the 9-month sleep regression. First and foremost, your baby is likely hitting some major developmental milestones. They might be crawling, pulling themselves up, or even taking their first wobbly steps. While these achievements are undoubtedly exciting, they can also be incredibly distracting when it's time to sleep. After all, who wants to waste time snoozing when there's a whole world to explore? Teething is another common culprit behind sleep disruptions at this age. Around 9 months, many babies are in the throes of teething, with as many as 8 new pearly whites making their debut. The discomfort and pain associated with teething can make it tough for your little one to settle down and stay asleep, leading to more nighttime wake-ups and general crankiness. Your baby's temperament can also play a role in how they handle sleep disruptions. Some babies are just more sensitive to changes in their environment or routine, meaning even minor disturbances can throw off their sleep game. A dog barking outside, a bit of light peeking through the curtains, or even a slight shift in temperature can be enough to rouse them from their slumber. So, how long can you expect the sleep regression to last? The answer, unfortunately, is not one size fits all. Some lucky parents might find their baby's sleep habits improve after just a few days, while others might be in for a longer haul of several weeks or even months. The key is to remain consistent in your approach and remember that this, too, shall pass. Now, let's talk about how much sleep your 9-month-old actually needs. At this age, most babies require around 12 to 14 hours of sleep in a 24-hour period, split between nighttime snoozing and daytime naps. This typically translates to about 9 to 11 hours of consolidated sleep at night, along with 2 to 5 hours of naps during the day. Of course, every baby is unique, so don't stress if your little one's sleep schedule doesn't perfectly match these guidelines. So, what can you do to help your baby, and yourself, survive this sleep regression? First and foremost, focus on creating a sleep-friendly environment. Make sure your baby's room is dark, cool, and quiet, with a consistent, low, rumbly white noise to help drown out any disruptive sounds. This white noise can also serve as a soothing sleep cue, signaling to your baby that it's time to drift off to dreamland. If teething seems to be the root of your sleep troubles, try some gentle pain relief strategies. A frozen washcloth or teething toy can provide soothing counterpressure on sore gums, while over-the-counter pain medications like acetaminophen or ibuprofen can help ease discomfort. Just be sure to check with your pediatrician first and follow dosing guidelines carefully. You might also find that the trusty white noise helps distract your baby from their teething pain, making it easier for them to settle down and sleep. Another area to examine is your baby's diet. As they approach their first birthday, it's important to make sure they're still getting enough breast milk or formula to meet their nutritional needs. Aim for around 24 to 32 ounces of milk per day, split between 3 to 5 feedings. You can also try adding some extra fat to your baby's evening meals, such as a dollop of avocado or a drizzle of olive oil, to help them feel fuller and more satisfied throughout the night. If you're still struggling to get your baby to sleep through the night, consider implementing a dream feed. This involves gently rousing your baby for a feeding between 10 p.m. and midnight, right before you head to bed yourself. The idea is to fill their belly enough to help them sleep longer stretches, without fully waking them up and disrupting their natural sleep cycles. Finally, if you've tried all the above and your baby is still waking frequently or fighting sleep, it might be time to reevaluate their bedtime schedule. An overtired baby can actually have a harder time settling down and staying asleep, so if your little one is resisting bedtime for an hour or more, try moving it earlier by 15-minute increments until you find their sweet spot. On the flip side, if your baby seems wide awake and raring to go at bedtime, a slightly later schedule might be in order. Remember, navigating a sleep regression is all about trial and error. What works for one family might not be the magic bullet for another, so don't be afraid to experiment and find what clicks for you and your baby. And above all, don't forget to take care of yourself during this challenging time. If you found this video helpful, be sure to give it a thumbs up and share it with any fellow parents who might be in the same sleep-deprived boat. And if you haven't already, hit that subscribe button for more parenting tips and tricks.